At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend How Fertility Markers Predict Your Future on Wednesday, November 19th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM WMAL.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Dr. Tom Roselle Live right here on 105.9 FM WMAL. Got another beautiful program for you, one that we can kind of provoke your interest in taking care of yourself. I hope, anyway, that's my game plan. We're going to talk about an ugly bad word. It's called your hormones and what they really have to do with longevity and the prediction of your wellness and so forth. It's, one of those things that we talk a lot about, but we really don't understand. Well, my job is to get you to understand it. My job is to give you the data that you can say, oh, I didn't know that. But even more importantly, on November the 19th, coming up in just a few weeks, I guess, at the Roselle Center for Healing in Fairfax, Dr. Stephanie Pina, who is an expert in hormone function. She's a doctor of naturopathic medicine, is going to be talking about hormonal regulation and what you predictors are of longevity and health and wellness based on what your hormones say. And it's a very true situation. We know that when certain things happen in the body, that longevity isn't going to be on your side, and you can measure them. And you can enhance them, and you can make them better, or you can ignore them and you can go down the tubes. So why don't we talk about kind of some of the basics and what that really means and what you can do about them and what you should not ignore. When we're talking about hormones and hormone regulation, it's a big, big topic. It's one that, we can sit here actually and talk about for hours and hours and hours, and in a professional setting, talking to to doctors and so forth. Most of these guys don't know much about anything. It seems to be they're really not taught about it. I'm being a little unfair, but here's really the situation. When a physician or a healthcare provider of any sort goes to school, they learn basics. Very much like you do at some levels. They learn what a growth hormone is. They learn what testosterone levels are and estrogen levels are and progesterone levels are and the roles that these guys have in different situations. But do they really understand the intimacy of what happens? Do they understand the biological clock that takes place as you go down through the years and so forth? Do they understand the impact it might have with your mental state? Do they understand the impact that it has relative to your healing process? Do they understand the impact that it has intimately on your heart? Not just your libido, guys. Your testosterone goes down and your muscle mass goes away and so forth. But do they get that your testosterone level is a primary indicator of cardiovascular function? Yeah, your heart. And if your testosterone level is getting its butt kicked, you're going to get all kinds of increased risks for death due to cardiovascular disease and heart attacks and other cardiovascular issues as well. So the short answer is not as many as you would like them to have information on and be able to understand it and apply it. How about estrogens in women? Guess what, guys? You need estrogens too. You need to have both hormone patterns, but just not in the same balances one to the other. Ladies, you need testosterone, but you don't need it like guys do. So estrogens, we think is a female hormone, but guys, it's yours too. Estrogens are supportive of cardiovascular health and bone health, and it supports your brain function. Higher estrogens are associated with lower rates of all-cause mortality. So the better the estrogen levels are, the more likely it is you're going to live longer. Excessive estrogen, though, can lead to bad things, right? Including cancers. But there's ways of blunting them. Now, excessive estrogens can be interpreted in one of a couple ways. It could be, you hear the term, by the way, I want to throw it in there, is estrogen dominant. Guys can be estrogen dominant as well. So what is dominant over what? It's actually a ratio. The first one that you use is estrogen to progesterone balance. Estrogen is necessary, as I just said, for all kinds of things, both in men and women. But if it gets too high, it causes an inflammatory degradation, a breakdown, and provocation of bad cellular function. That's called cancer. And so we have to make sure that it's not artificially too high. That's called xenoestrogenics, or it's normal, but it's not. It's high now in compared to not enough progesterone. They both can be damaging, but you have to have some. So you go to the doc and say your estrogen level's fine, but did they look at your progesterone? Well, your progesterone level's a little low. By definition, that's called estrogen dominant. It's dominant over the lower progesterone, and the problem can be just as provoking. So we have to look at it at different levels, and the predictor of these things are significant. Insulin is what diabetic, if it's not working the way it's supposed to. Insulin can cause all kinds of stuff. What did I say? Do you like that all kinds of stuff? So here's what I'm talking about. Insulin regulates blood sugar, but aging can lead to insulin resistance. Now, is it the aging process, or is it something else taking place? Well, it's a combination of a couple things. As we get older, our cells don't repair themselves as quickly as they did when we were young. And that has a lot to do with something called growth hormone. And we can get into that, but we're just going to touch the surface a little bit so you get a better understanding. So that insulin level that doesn't work so good as we get older is a result of other hormone patterns, but also a result of inflammation as a result of what? All the garbage that we put in our system, all the things that we're exposed to, all the things that we do, damn well we shouldn't be doing them, and so forth. Now, here's the other piece. Did you know that if insulin becomes resistant, means that it can't transport into the tissue? What are we transporting? We're transporting blood sugar. If it becomes tissue resistant, so it can't get it in, you increase your risk dramatically of age-related diseases like Alzheimer's, cardiovascular disease, diabetic neuropathies, tissue destruction, kidney problems, ocular breakdown, and the list goes on. So what's the person to do? Well, it's like, let's take control of our environment and wonder why we have these things showing up. We can start with the quality of food that we put in our system, and most of it's garbage. You know my old cliche, right? Sugar, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, and so forth and so on. What happens? Have we put up with injury patterns, pain that just doesn't go away because we've really never taken care of it, never done anything the right way, except for taking a pill. Here, take this, it'll dumb it down. We worry about all the illegal drugs coming into the country, but we forget about all the legal drugs that we just chomp down like candy. And that causes a problem. That can cause that pain pattern never to go away, which increases the inflammatory reaction, which increases the resistant pattern of any kind of transportation into the cells that we need. So subsequently, we have Alzheimer's. If your blood sugars go too high and you see mental degradation taking place, we're lovingly calling that type 3 diabetes. Yep, you got type 1, you got type 2, this is type 3. And because the brain needs what? Sugars. It's the number one food it needs. But it can only use so much of it. And when it's sitting up there and it can't either get into the tissue because it's inflamed, or there's too much sitting around, it's going to get hard crusted. What do I mean by that? Do you ever take a saucepan, put sugar in it, and on the lowest heat possible, just kind of stir it around? Pretty soon it gets what? Gets thick, gets hard. Does the same thing in your body. It's important that you understand what really happens because you're the one that's in control. It's not about taking another drug to fix it. It's about changing some of the things that you're doing to make a difference. Because if you don't change it, nothing's going to work. Now, you get to the place where there's too much of too much, and you're going to have to do something to help it along a little bit. You know, we see tons of cases of diabetic neuropathy. That's due to the insulin level not working the way it's supposed to because we've been beating up our body's capacity to transport blood sugar for a long time. So if you'd like to know a little bit more about that, why don't you circle a date on your calendar? Why don't you circle November the 19th and come over and join us at the Roselle Center at 6 p.m. And Dr. Stephanie Pina will be your primary presenter. This is a topic that we all need to know a lot about because there are things that you can measure and change and make a difference. So if that's the case, what do I want to measure? How do I want to, put it to good use? How do I want to say, I got to make a change here. There's something that's not okay anymore. Well, let's get into that just a little bit. Let's talk about what needs to be changed and how you can make a difference in your life, in your health across the board. Okay? Wouldn't you like to know about that? I think I'd like to know about it. I'd like to know a little bit more about that. So let's get into it just a little bit. So if we go to the doc and we say, Doc, are you going to measure my hormones? And they'll say, yeah, I'm going to measure your hormones. And what hormones are you going to measure, Doc? Well, which ones do you want me to measure? How many of you heard that, by the way? And they do maybe thyroid hormone. And they do what? They do TSH, thyroid stimulating hormone. And they do what? T4, which is thyroxine. If you're lucky, maybe they'll do T3, which is the active hormone, but it has to be transported. But they don't do TSH, total T4 and T3, free T4, T3. They don't do T3 uptake. They don't do reverse T3. They don't do TPO. They don't do thyroid antibodies. And a lot of times when you suggest that, well, we did it once, you were fine. Well, what about now? That was then. How about now? And, well, let's see what comes back on this. Comes back what? There's certain things that need to be done as a group. Vitamin D3 is known as a hormone in many circuits as well. But your insulin level, your thyroid hormones, your testosterone levels, your different fractions of estrogens, your growth hormone, and it goes on. Why aren't we measuring all those when they can be a predictive measure of cardiovascular disease, tissue degradation, mental health, not only libido and things like that we want to know something about, but all these other things? Wouldn't you like to be able to take action steps if you really knew that knowing these things could make a difference in your health long term? I don't know about you, but just call me a little different. Those are the things I make sure that I run all the time. And when we do any kind of, if you will, physiological analysis relative to blood work or saliva tests or urine tests, we're going to run different fractions. Your hormones, for example, ladies, if we're going to do estrogen values on, we have a lot of choices. We can do saliva, we can do blood, we can do urine, and they give us different looks at different pieces. And you have to understand them all to really understand where the glitch in the mechanism might be. What happens if you're not sleeping at nighttime? Well, that's something called melatonin. Melatonin is a circadian rhythm modulator. That means it balances the night and daytime patterns. But did you know that you have many different types of circadian rhythms in your body? You have sleep regulation, you have energy regulation, you have gonadal regulation, you have a lot of things that melatonin, or that pineal gland, if you will, optimizes. So knowing that, wouldn't it be good to know what the level of melatonin is and it can be measured? Wouldn't it even be better to understand that if the pineal gland isn't working the way it's supposed to because it has a calcium oxalate crystallization around it because of our environmental impact of fluorines and chlorides and so forth, that there might be a way of shifting that? Just simple breathing patterns someplace. How many docs know how to teach you how to breathe, to do things in a little better way? How many of your doctors can tell you how to put your body into a parasympathetic healing pattern? That's where you heal. Parasympathetic opposed to sympathetic. I'll give you an example how you could do that. Something that is real simple. Sit quietly, get away from everybody, close your eyes, and breathe in slowly for a count of 5. Slowly, very slowly breathe in, slow count 1, 2, count of 5. Then when you get to 5, hold your breath for a count of 5. Then slowly let that air out for a count of 8 to 10. Do that several times. You do that 3 to 5 times, and you're lowering your body's fight-flight reaction, and you're going to put yourself into a parasympathetic pattern. And those of you who can't sleep, try that first. You may find that all of a sudden, God, I'm out. I didn't know I went to sleep so fast. Parasympathetic is where you heal. And that's just one little piece that can make you do that. Breathing, and there's many different breathing forms, but that's one that puts you into parasympathetic, that it allows your body to relax, to repair, to restore, to optimize its ability to exchange cells for the good. So knowing that you can start doing different things, wouldn't it be good to be able to measure that? And you can measure it by hormone influence. We talked a little bit about the inflammatory reaction that prohibits insulin from transporting blood sugar into its targets. It's not just a matter of measuring glucose. It's not just a matter of measuring A1C hemoglobin, but there's another one, and that's called LDH. See, you could be at the top end of normal of the A1C hemoglobin, which, let's say you're pre-diabetic pattern and you're at 5.7, 5.8, maybe 6.1. And your doctor says, well, you're in pre-diabetic, we got to make some changes and so forth. But if your LDH level is elevated, you're diabetic, straight up, because your liver is responsible for that regulatory pathway, because that's where your blood sugar, your glyconeogenesis is triggered by. Your adrenal glands trigger your insulin production from your pancreas, but it does that also to stimulate the liver to release glucose in the storage of fat tissue. You have to understand these pieces and what they really mean for your life, your longevity, the quality that you want to live with. You know, we're supposed to live at about 130 years, right? How many of us actually make it? You know, and make it well, not just sitting around as an invalid in a bed or in a wheelchair someplace, but able to go out dancing and do the things we want to. You know, we're seeing more and more of that, you know, thanks to the internet. I hate the internet, by the way, but it's out there anyway. But the couple things that it does show that these things are possible. You see, you know, old timers dancing and doing the jig and so forth. It's like, wow, what happens? Can anybody do that? The short answer is yes. But you have to know how to and be willing to change things that you're doing that maybe not be as supportive. If we have a good gut, a microbiome, then we start noticing that there's shifts in the quality of other elements, other hormones within our system. So that's one thing that we probably need to measure. If we know that our estrogen levels are adequate and they're being balanced properly by progesterone, we're probably going to be less susceptible to certain types of cancers. Wouldn't that be a good idea? If we know that we're transporting blood sugars adequately and we're using them at high enough level with good nutritional balance, your vitamin B and your zinc levels and your chromium and so forth, we're probably not going to end up with old age dementia. If we know our cortisol levels are adequately controlled, we're not going to break tissue down and degrade to the place where, we have destroyed our bodies. We don't have any muscle mass anymore. It's eating us up. Cortisol is a good thing, but it needs to go away. Not completely, but it goes at a much lower level. But if it's staying jacked up all the time, we know that we're destroying tissue. What's our antibody levels doing that are provoked by adrenal hormone? What's the antibody? It's called IgA, gliadin antibody. What does that have to do with anything? That has to do with your gluten sensitivity. And again, going back to hormone dysregulation in the adrenal system. We didn't think about that, did we? Nobody's talking about that, are they? They're not telling us that, we have to fix that system structurally, chemically, neurologically, or we're not going to get anywhere. We're going to be stuck with taking something for the rest of our life, a gluten enzyme, or having to stay away from everything for a long period of forever. I don't know about you, but if there's a way to fix my life and make it optimized as best we possibly can, I think I'd like to have the answer. Look, there's no saints. All of us are sinners at some level, right? We all eat garbage on an occasion. But how occasional is it? How much are you doing? Is it an ongoing process, or is it something that you just do seriously once in a great while? Your body's very forgiving. It'll forgive you for stupidity on an occasion, but it won't forgive you if you're doing it all the time. So we have to make sure that we have the tools, that we understand it. So you're going to join us on the 19th here at the office at the Roselle Center for Healing in Fairfax, Virginia. And we're going to talk about your hormones as a predictor of longevity, health quality, and your capacity to go and do. Dr. Stephanie Pina, who's a doctor of naturopathic medicine, will be your primary presenter. This woman knows hormones inside out, upside down, and backwards, and she's going to take you through the pathway. And we're going to talk about these things because they're important to you. They're things that you have to know about. And if you don't, shame on you. If you don't get it, you're going to get something that you don't want to get. But join us. Call the office, 703-698-7117, 703-698-7117, and register. Or you can do it online. Go to rosellecare.com. That's rosellecare.com. Register that way. Anytime you want to find me and see what I'm doing, go to drtomroselle.com. You can find all our past radio programs and our live streams and everything else that we're doing there. Sign up for our newsletter so I can send you information so you get what you need to get to help yourself. Coming up to the end of the program, we're going to go directly to the live stream. Join us. Go to drtomroselle.com and click in, and let's continue this conversation. I think you're going to find it fascinating. We're going to cover it from time to time over the next few weeks. Remember, I'm here every Sunday at high noon for one reason and one reason only. I love you all. Have a great day. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend How Fertility Markers Predict Your Future on Wednesday, November 19th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.